Good evening, ladies and gentlemen, and welcome to our Eating Disorder Hope webinar presentation in conjunction with the Meadows Behavioral Healthcare, featuring our special presenter for this evening and featured guest, Deirdre Stewart, who is the Director of Trauma Resolution Services with the Meadows Behavioral Healthcare. Before we begin, I would like to point out just a couple housekeeping items for all our attendees who are joining us this evening. First, just be aware that you will have the opportunity to submit questions to Ms. Stewart, and we will be transitioning into a Q&A period following her presentation this evening. So if you have any questions during any point of her presentation, please feel free to submit them via the questions pane of your control panel. And again, you can do that at any point of our presentation, and we will have a Q&A portion following her presentation. Also to point out that you do have access to a PDF file of her presentation slides for this evening, and you can access those and download them from the handout section of your control panel. So please feel free to download those and access them and follow along during her presentation. Lastly, for eligible participants who follow the entire presentation, you will be eligible for 1 CE credit for tonight's presentation. Following Ms. Stewart's presentation, I will be including a live link in the chat portion of your control panel, and that will take you to the survey that you will need to complete and submit in order to be eligible for the CE credit. I will make sure to repeat this information following her presentation, but please be aware that you will need to complete a survey in order to be eligible for the CE credit. So without further ado, I'd like to transition this over to our featured guest, Ms. Deirdre Stewart, who will be presenting on eating disorders and the Brain Center, incorporating neurobehavioral therapy in eating disorder treatment.
Thanks, Crystal. I really appreciate it. Good afternoon, everyone, or good evening, depending actually where you are geographically. Thank you so much for having me. Really grateful to be here and excited to share with you a little bit about our Brain Center. So I'll go ahead and get started. What I'm planning to cover in this afternoon's presentation is I want to provide an overview of the arousal model and the triune theory of the brain, which many of you might already be familiar with, but I just want to spend a little bit of time laying a foundation, especially since the arousal model is the context with which we conceptualize our patients when assessing the various types of neurotherapy. So I just want to spend a little bit of time on that. And then I want to talk about how we use the arousal model and the triune theory to determine which devices in our brain center are most appropriate and clinically indicated for each patient based on their nervous system arousal profile and what their brain waves are doing. And then the last thing I want to cover is, and I want to spend the majority of time describing to you the various devices and equipment, and also share with you the results that we're seeing. And I have an informal case study that I want to take us through. So that's just what I'm going to attempt to cover in the next 45 minutes and leaving time for questions at the end. And I just want to mention here that with any or all of the devices that I'm going to describe, as effective as they are, they're really not meant to be used as standalone, in my humble opinion. They're to be used as an adjunct or a complement to whatever modality you're already currently using. And in saying that, what I've really noticed since we opened our first Brain Center, which was actually back in July of 2014, in terms of the bigger picture, is that through the Brain Center, since we opened, through the various types of neurotherapy that we offer, neurofeedback, etc., our patients are really, they're better able to absorb and receive and integrate all the other aspects of our program. And it's because they're consistently spending time in the Brain Center, they're quieting their systems, calming their nervous system, we're able to better reach their minds, and it deepens their experience here. So they're able to be more present in the group for their individual sessions, for art groups, and so on. And I think that's been a really huge piece and a true gift. So I wanted to mention that. That actually reminds me, one of my great mentors early, many years ago when I started neurofeedback, said that if someone told him he could no longer use neurofeedback, he wouldn't want to be in practice any longer, just because it just makes everything else so much more effective and easier. It's more sustainable traction at a faster rate. So who doesn't want that, really? So, all right, with that, I'm going to get started. So, as I said, when we opened our first brain center back in July of 2014 on the main campus, and since then we've opened brain centers across all our facilities. Bermuda Ranch, our eating disorder facility, all of our facilities have a brain center. What we were wanting to do is to really capitalize on this concept of neuroplasticity, which is that our brains have this miraculous capacity to change and learn. We can actually build new neural pathways, in essence, and repair old ones. So this is the whole premise on which the brain center was built. And that, if we focus our attention in new ways, and I think this is a really key part of the presentation, that if we focus our attention in new ways through biofeedback, through neurofeedback, we have the capacity as organisms to get neural firing to flow into undifferentiated, unlinked areas. And I think this is huge. So we're basically changing the structural connection, and the more connected our neural mechanisms, the more regulated we're going to be. So, because this is such an important concept, we do spend time educating our patients about this. Oftentimes, by the time they get to us in residential, they've been doing what they've been doing for a long time, and I can't help but think of Aristotle says, we are what we repeatedly do. So we like to educate them on this concept of neuroplasticity and to let them know that with our program, our brain center, with neurofeedback, we're going to be providing them with this incredible foundation and a sense of nervous system support, but that this is an ongoing process. So I think that's important. There's really no quick fix, but the neurotherapy is really quite accelerated, and as I said earlier, the amount of traction you can get quicker is still blows me away. So I have a lot of joy about that. The topic of neuroplasticity also reminds me of I was at a neurofeedback conference not too long ago, and there's a speaker there put forth this concept that there's actually no such thing as mental illness, and that it's all just electrical disruptions in the brain. And I really liked that idea or that theory, because it not only destigmatizes mental illness or disordered eating behavior, but by saying that it is a brain disorder, but it instills hope, I think, to our patients that your brain's just not firing the way we want it to, and there's a solution, and research is on board with that. So I think that's also an important piece. So I just wanted to mention neuroplasticity for anyone who wasn't familiar with it, because it's what allows us to do what we do. And also to note that the front of the brain, or the mid regions of the brain, are more malleable and plastic than, let's say, the back of the brain, or the lower subcortically you get, the less plastic the regions are. For example, the brain stem, not so much, not all that plastic. But that's not to say that we can't affect the brain stem or the back of the brain being more connected to the front of the brain. We are able to impact that, and research has shown that. fMRI scans show that. So it's incredibly exciting. Okay, so the arousal model, and I know I've listened to many of the webinars on ED Hope website, and they're amazing. And I know that several speakers have mentioned the arousal model, so I don't want to spend too much time, but just to lay a foundation. So again, this is also the conceptualization picture that we use when we're treating them. And we've got here over-arousal is, I would say, the majority of our patients present with over-arousal. They're in a highly activated state, and their systems are just sympathetically charged. And so we're, again, with our neurofeedback program in our brain center, we're really trying to calm and quiet their systems. So we've got the over-aroused profile. We have under-arousal, which is more of that below that perforated line, more the shutdown, the freeze, the depression, more of a parasympathetically dominant person. And again, we also have people that have that are dysregulated, and they've got over and under happening simultaneously. They've got their foot on their gas, foot on the brake. They're wired, but they're also exhausted. So that's an important piece. And also to note that someone who's in freeze, in that shutdown, usually as they begin to thaw out, there's usually a large amount of high activation survival energy underneath that freeze. But that freeze response happens when my system decides that running, fleeing, or fighting are not viable options. That's that stage 3 PTSD when our system's shut down, and the possum that plays dead. That's our last ditch effort at survival. So there's the arousal model, and let's see. Okay, brain waves. I want to talk about brain waves as they relate to our states of arousal. So, and I don't know how many of you are familiar with brain waves, but again, I'm going to lay a brief foundation here. Delta waves, starting from the left side here, delta waves are sleep. Slowest, 4 cycles per second, slow waves, real slow waves. And then we have theta. Theta waves are theta is what we pass through right before we're about to go to sleep. And theta waves, when we're feeling drowsy. The other thing about theta, though, is important to note is it also is what's firing if I have an insight or a creative idea. So theta's got its time and place. Creativity and insight come out of theta. Now, what we don't want is, and what we see a lot with our patients, is too much theta in the front of the brain, too much slow wave activity in the front of the brain. What that will manifest as is ADD, depression, and oftentimes these patients are or have historically sought out stimulants because they're trying to stimulate their brain to make it more alert, because there's just not enough alertness in the front of the brain. And that leads to an under-aroused profile, and I'll get a little bit more into that later. High theta in the front of the brain is also indicative of childhood traumatic experience, and trauma is actually stored in the theta waves. Theta waves are what we're firing during the time of the trauma, time of the terror. So that's also important to note. And as we support our patients in decreasing their theta, we have to do it in a very slow, titrated way, because if you think about it, if you take down slow wave activity too fast, it can be super activating. So that has to be done in a titrated, slow manner, is not to activate someone too much by taking away their excess mellowness, so to speak. Now, the next wave is alpha, and it's the one I'm hoping you'll take away from this presentation the most, is remembering the importance of alpha. Alpha is the anchor of the brain. It's what enables us to feel calm and relaxed, but also focused and alert. Not hypervigilant, but calm, alert, and focused. And it's what's firing when I'm meditating. It's what's firing when I'm doing yoga. The Dalai Lama walks around in alpha. It's it's when I'm present in the here and now, that's when alpha's predominant. And I will say now that our patients, our eating disordered patients, the marker that we are seeing is low alpha. So that our brain center, our neurofeedback, a lot of it is geared to bringing up that alpha. And I'm going to say right here too that oftentimes patients show up and they have high theta and their alpha seems to be kind of in a normal range, but then when we bring the theta down, their alpha drops way too low.
Yeah, that's fine for me, I understand. And then, but did you commit to having it done by Sunday?
Yeah. Basically, their theta was falsely bringing up their alpha. So once we get their theta within normal range or their beta in normal range, we get the true picture, and the true picture is extremely low alpha. And I'll get more into that shortly. Okay, next wave is SMR, which occurs at 12 to 15 cycles per second. Sensory motor rhythm is what that stands for. That's relaxed thought. Beta is the next wave that occurs at 15 to 18 cycles per second. Right now, hoping my beta is firing and is the most dominant wave. It's active thinking, busy, and higher along that continuum is high beta. High beta that's more subject to day-to-day variability, so it's not my true baseline. Beta 15 to 18 is more of your true baseline, indicative of anxiety, etc. If you have too much beta, you're going to have anxiety. But the high beta is more subject, as I said, to day-to-day variability. You know, if I have a day where I'm late for work, I get a flat tire, my beta is going to be my high beta is going to be way more elevated than usual. It's also where if we have any body tension, which our patients have a ton of body tension, especially their jaw, we're hooking them up to the neurofeedback systems and their high beta is off the charts, and what we're supporting them and inviting them to do is, put their tongue on the roof of their mouth and just to notice that they're tight, and just to see if they can let go a little bit and release, and then the high beta starts to drop. So high beta, a lot of that is body tension. Okay, so I will, and this next slide is, I'm not going to spend too much time, but it's just, if you wanted to reference back ever, it's a great summary of all the brain waves. We want all the brain waves are very important. We just want them firing in the right amount at the right time throughout the day, depending on what activity we're engaged in. So it's kind of like the Goldilocks. Too much, we want to have it be just right. So that's just the different brain waves than when it's a normal range. Restful sleep and intuitive, calm, relaxed, present, ready, focused, and engaged. So, and our patients obviously don't show up in that state when they're here, or they wouldn't be here. So that's one of the goals there. Okay, and then Triune Brain, just very, very briefly, because I feel like many of you probably already are familiar with this. The prefrontal cortex is executive functioning, who I am in the world, what I stand for, my values, what I believe in. Limbic system, emotions, mammalian brain, approach, avoid. And a lot of what we're doing with the brain center devices and the neurofeedback and neurotherapy is quieting the subcortical regions and strengthening the front of the brain so that it can act as an inhibitory mechanism for these lower regions. Because I think, as we know, that the limbic system is so important, but definitely a terrible driver. We don't want that limbic system in the driver's seat. We want the frontal regions in charge, inhibiting the lower regions. So again, that's our goal of what we're doing. And then the brain stem is what's keeping my sodium levels in balance right now, sleep, breathing, and being in the here and now. And again, regulating at the brainstem level is super important, and one of our devices does that, and I'll get into that. Okay, so yeah, basically the devices that I'm about to describe, they all intervene at different levels of the brain. By the time patients reach us here in residential, they're log jammed in one of 3 of these different areas of their brain. So if we can resume functioning in these different parts of the brain, then our patient, there's the emergence of this, calm, present, focus, what we refer to here as the functional adult. So it's just, they're able to be more present and calm and focused. And the different devices intervene at the different levels. So that's, okay, so cranial electro stimulation, I'm going to talk about that first. This is just an overview, and again, mainly a slide that I want you to be able to refer back to just for a quick footnote of, okay, what device is this and what does it do? And I'm hoping that any or all of you will be able to use these devices in your own practice or in your own community mental health. Is just, they're phenomenal adjunct support systems for support for extra-regulatory support. So the CES is an entrainment device. It intervenes at the front limbic and brainstem levels. And I'm going to talk about heart rate variability, which is a form of biofeedback that intervenes at the brainstem and hypothalamus. And then the hemoencephalography machine is HEG for short. That's a form of neurofeedback using infrared, and that intervenes frontally. And then the last final device I'm going to talk about is the traditional neurofeedback that we use here. And again, that intervenes at all levels depending on where we place the electrodes and what protocols we're using. Okay, so low alpha as a marker for disordered eating behavior. Just wanted to put forth that, just a hypothesis, that something that I've seen, that we've been seeing. Themes and patterns tend to emerge as we're doing this day in and day out. And low alpha is internal anxiety, exhaustion, emotional reactivity. A big one that we see is patients have difficulty with state shifts, even tolerating positive affect. So that's an important piece. And again, every device in our brain center is designed to increase alpha. So the CES, it's been around since 1979, FDA approved, non-invasive, evidence-based for sleep, insomnia, anxiety, depression. And it's using a tiny amount of electrical current through the earlobes. And its entrainment device, by definition, means it's purposely guiding the brain waves into a desired state. So it might be taking some of the slower theta waves and bringing them up into an alpha place, or it's taking some of the beta and bringing it down into alpha. So it's purposely guiding the brain and training them into a desired state, specifically alpha in this case. And patients, they come into the brain center, and this is actually one of their favorite devices because they don't have to, quote unquote, do anything. They get to receive this entrainment. Some of the other devices require more work, more efforting, more interaction. But with the CES, they come in and they're able to, lie down in a reclining chair, and we hook them up to the CES, just earlobes, electrodes onto the earlobes, and we put actually a weighted blanket over them, and this provides them with proprioceptive input into their system. So, proprioception is where I am in relation, where my body is in relation to time and space. So it's like a containing cocoon-like boundary effect. For any of you out there who are familiar with weighted blankets, they're an absolute game changer for grounding. grounding purposes. And so they have the weighted blanket on, they have the cranial electral stimulation, and it's amazing the down. I can see the down regulation as it's the quieting that's starting to happen. They'll take those relief breaths, those settling breaths. Oftentimes they twitch because the parasympathetic branch of the nervous system is kicking in, and it's like, you know, oftentimes, and I hate to say this because it breaks my heart, but oftentimes it's like this is the first time their system has felt relaxed in a long time. It's like, wow, this is what it feels like to feel calm and relaxed and not just braced to fight or flee. So that's a really, it's a gift for them. And I noticed the first, I would say, month that we opened the Brain Center, I specifically remember, because our patients have this on button and this off button, and none of that arousal slide, they have nothing in between. That range of resiliency is so small, that window, that they come in, and the minute they start to feel relaxed, they'd fall asleep. And I thought, okay, the CES doesn't work if you're asleep, because Delta's predominant if you're asleep. So what we started inviting them to do is to journal, to come in and journal, you know, work on their step work, do some mindful mandala coloring, reading, any activity is okay, and you're still receiving the entrainment. So that helped a lot, just to keep them, you know, awake enough to receive that. But it was interesting to note how they come in and they just fall asleep. So the other thing about CES is we have some patients that are, you know, feeling like they're ready to jump out of their skin, and they'll go in for their individual session, and we can put on the CES while they're receiving, let's say, an individual somatic experiencing session. So that's also just as extra regulatory support. So what else did I want to say about? Yes, stimulates alpha waves. There's many different programs on the CES. I mean, there's a mood booster. There is a program specifically for sleep. Patients will use that one a lot at night. They have availability daily to come into the Brain Center, day or night, and the patients that come in at night, they will use the sleep, obviously, you know, as they're preparing for bed. But it also, the CES increases blood flow, and it's changing brain chemistry, cortisol, so, you know, physiology is being affected as well. Yeah, in the summary sheet, again, something just that you can reference back to that I want to mention is the effects are immediate in that patients will notice relaxation, you know, whether they're on it for 20 minutes, half hour, 45 minutes, they notice that they feel calmer, but also the effects are cumulative. So if a patient's coming in 3 times a week over the course of their length of stay, they're going to get more and more impact and more results. Their alpha is going to continue to go up. So if I took their brainwave reading of alpha prior to a CES session and then post, their alpha would have visibly gone up. So that's the other piece I want to mention here is with our neurotherapy program and the Brain Center and Neurofeedback, what we invite all of our patients to do is to choose what's one thing that you would like to improve, get rid of, get better, etc. Just that intentionality piece and the art of start, you know, less anxiety, that's a big one, and it's about how are you going to, you know, having them identify, you know, how will you know that you've decreased your anxiety? And, you know, oftentimes asking them, we have them verbalize or fill out a form before and after the Brain Center. I feel less anxious, or I feel more relaxed, and really inviting them to describe to us, how do you know you feel more relaxed? How does your body tell you that? So they can really begin to notice it and experience it, and on a felt sense level versus just, you know, in their head, but just, wow, I feel more relaxed because, you know, my butterflies in my gut are gone, or the tension in my chest is gone, or, really having them get the specificity of it, of how they experience that on a body level. Okay. Next device I want to talk about is heart rate variability. And this is a form of biofeedback. It's a participatory learning tool, and it teaches us how to gain voluntary control over functions that would otherwise be not voluntary. Heart rate, blood pressure, hand or foot temperature, and breathing. And just, I don't know how many of you are familiar with biofeedback. There was a study back in the 90s by Eugene Peniston. It was actually one of the most compelling pieces of research. It's actually what got me, when I saw that research, I thought, wow, I need to know more about this neurofeedback. Pre-post MMPI scores, 6 weeks of neurofeedback showed significant changes in MMPI scores. It was absolutely mind-blowing. But Eugene Peniston used to, he wouldn't do neurofeedback on someone until they had proven that they could raise their temperature 10 degrees, which had, let him know that they had mastered at some level the concept of biofeedback, where I'm basically looking at a mirror. I'm watching what my breath is doing, I'm watching what my heart rate is doing, and I'm learning how to regulate that. So that's an important piece. Okay. So heart rate variability is the natural occurring beat-to-beat variation in heart rate, and this is heart rate variability is the clearest window into the autonomic nervous system. So it's telling us how well our sympathetic and our parasympathetic branches are working. And we want flexibility. We want the variation in our heart rate to be there. The more variance, the better. Okay, so basically how it works is the patients come in and they're, again, put an electrode on their left earlobe. It's tracking their pulse and their heart rate. And they're watching a screen, which is giving them visual feedback on, I'm going to use the one that's my favorite, the hot air balloon. They're watching the hot air balloon, and the hot air balloon is moving up, and it's moving up, and then they start thinking about yesterday, about something that happened to them that was activating, and all of a sudden the hot air balloon starts to drop, and they get frustrated. And the more frustrated they get, the more that hot air balloon drops to the ground. And then what we do is we invite them to, take a deep breath and think of a time when they felt most happy or most like themselves, or something they're grateful for, and then all of a sudden the balloon starts to rise again. So again, they're just getting this second by second feedback of what their system's doing. And I think what it really does is it teaches them, first of all, the HRV teaches our patients, or anyone who uses it, how to breathe diaphragmatically. And that is, for so many of our patients, their breathing pattern is dysregulated, and they're shallow breathers, and teaching them how to breathe, I mean, nothing could be more important than breath off the top of my head that I can think of. So just being able to, and I want to share on a personal level, I no longer use an inhaler after using the HRV for extended period of time. So I can speak to this system from the inside out, all of them actually, but wanted to just share that yeah, this device teaches them to gain mastery over their physiology, and that if they learn how to, just by watching the screen, they learn how to breathe more coherently. And again, it's a practice. And that the other piece with biofeedback, with neurofeedback, it's like if we just give our systems guideposts, it's like it just nudges here and there, it's gonna, there's an organic intelligence to our organisms, and it's gonna start figuring out what it needs and wants to do to get back to homeostasis. And the other piece about heart rate variability too is more messages get sent from our heart up to our brain than our brain down to our heart. So if we can get the breathing and the heart rate more coherent, then it's sending the messages back up to the brain. You know what? Everything is absolutely copacetic. We're good, you know. And so we're interrupting this constant feedback loop that our patients are oftentimes in. You know, if my jaw's tense, then it's telling my brain that we're about to go, we have to go flee or fight. And if if I can interrupt that, then the feedback loop becomes everything's okay, and then my body's calmed down, and then my brain is everything, you know, the feedback loop is supported in that way. Okay, and the other, this is a picture that just shows when I have a negative emotion or perceived negative emotion, upset, the breathing pattern loses its coherence and the variability is not there, versus gratitude and appreciation. The more variance, the better. And I also just want to mention the ACE study right now, just because I just thought about the ACE study is, just to put the heart rate variability into another context. The ACE study, I think it was in the mid-90s, 95, 96, 97. It was the largest public health study, and it began in an obesity clinic. Basically, it linked traumatic exposure in childhood. So, you know, any experience that was overwhelming, too much, too soon, too fast, any experience that was less than nurturing, that it resulted in adult health conditions, you know, ranging from headache to depression to heart disease to diabetes to pulmonary illness to autoimmune disease. So the heart rate variability, this biofeedback device, it's a way to reverse these issues and again bring us back to homeostasis. So it's about regulation, but also support, you know, longevity, longer lifespan is just another really important piece there. Okay. And just again, variances, we want the more adaptability we have, the better. Back in the old days, the more adaptable we were to our environment, the more likely we were going to be to survive. And where I keep emphasizing that variability is good, low heart rate coherence, if the intervals are the same and there's not a lot of variation, the symptoms that are associated with that is general anxiety disorder, depression, phobias, OCD, diabetes, asthma, insomnia, IBS, so that poor coherence. So again, and this is just a slide I want it in the far right this is the first phase of the heart rate variability program that we support our patients in using. It's a coherence coach. So basically they're learning to pace their breathing, and they inhale, and they inhale, sympathetic branch kicks in, heart rate goes up, and then they exhale, heart rate slows down, parasympathetic branch kicks in. So they're just starting to pay attention to their breath in a very specific way, and that in itself is usually very regulating and calming for them. And again, this is just a slide here to give you a summary to look back to reference. I don't want to read off the slide, but the fact that this device intervenes at the brainstem level is amazing to me. And I also just want to mention one other thing is, just in summary, the heart rate variability teaches patients how to breathe diaphragmatically, teaches them that they have mastery over their physiology, and that, you know, their emotions do affect their breathing and their physiology. But also the thing I hear the most from patients from the HRV is higher energy. They notice their energy goes up. because their body's working more efficiently. And the other piece that I hear them say most often is less reactivity, less, they don't go to 0 to 60 as fast. So I wanted to mention that. This is just a slide. The blue line is breath. The red line is heart rate. So just wanted to show the different phases of how they slowly start to become more coherent and in sync with each other. And being mindful, I don't want to run out of time here. The other piece too that was a game changer I want to mention to anyone out there that is using neurofeedback or biofeedback is that a lot of our eating disordered patients have performance anxiety, have perfectionism, and what we discovered is that they don't have to stare at the screen the whole time with biofeedback, with the HRV, or with neurofeedback. They can, what we do is we invite them in the middle of a session just to have a look around the room and orient to the room, orient to their environment, connect to the environment through their senses, which is, orientation is one of the oldest intrinsic biological patterns that we have. If you think about a cat jumps off the balcony, the first thing it does when it lands is it rights itself, it connects, it looks around, and it orients back. That is a very calming mechanism. So when they start to look around the room and orient, and all of a sudden their coherence goes up and their score goes up and the balloon goes up, and same with the neurofeedback, because they're still, with neurofeedback, they're still getting auditory rewards. They don't need to be getting the visual, and with the heart rate variability, they're still reaping the benefits even if they're not staring at the screen the whole time. So I just wanted to mention, with any form of feedback, you can glance back at the screen, but you don't have to sit and stare at it to get the benefits and the results, and it's still highly as effective, and it makes the feedback experience much more positive. Okay, so stress reduction and emotional balance. And hemoencephalography machine, this is a form of biofeedback, hemo meaning blood. And what this is, the heart rate variability is a great system for people that are dysregulated, which they're over and under aroused, foot on the gas, foot on the brake. This HEG is ideal for solely under-aroused patients because, again, these are the patients that have too much slow wave activity in the front of their brain. So what this, it's a headband. It's just showing what the setup looks like. And basically, it's a headband that's measuring blood flow in the front of the brain. And the visual feedback, it's almost like it simulates hang gliding through the Grand Canyon, and as you're moving forward, that means you have ample blood flow, more neurons firing, more alertness, more activity. The minute I start to think about a resentment or something that's upsetting me, the hang glider either stops moving or it starts moving backwards, and that means that I've lost blood flow, ample blood flow in the front of the brain. I've gone limbic, quote unquote. I've moved down. So it's that second to second feedback, and it's about, this is a great device for strengthening that frontal cortex. It's ideal for depression, ideal for ADD, migraines, but again, that under aroused profile. And I have this, helps to quiet the amygdala, all the subcortical regions. Okay, and then a summary of the 3 devices that I've just spoken about. And then I'm gonna, this is just a slide where I've superimposed brain waves with the arousal model with the devices. So, because I'm a visual person, so just to reference back to what waves are in excess or deficit with over-arousal, under-arousal, or dysregulated, and which device is clinically indicated. Okay. Last, I'm going to take maybe a few more minutes, and then we'll take questions. Last thing I'm going to talk about is neurofeedback, traditional EEG, electroencephalogram, neurofeedback brainwave training. And what we do is we take a picture of their brain with the eager system that we use, and we actually take a mini map, and this tells us whether they're more over aroused, more under aroused, or more dysregulated, so we can really custom tailor their treatment in that way, and their neurotherapy program. So we're taking a picture of their brain at rest, where their alpha is, where their theta is at rest, where their beta is at rest. That's kind of what it looks like when you've got the electrodes on. Many of you might already be extremely versed in all of this. Mood, energy, clarity, and sleep are the things we're trying to impact. And basically, it's just mirroring back, the screen is mirroring back what our brainwave activity is doing, and it's getting rewarded as it makes more alpha, or it's getting rewarded, it's telling, make more alpha, don't make as much theta, don't make any more beta, and the patients are getting auditory and visual rewards for creating more of a specific brainwave. Okay, so I just want to show, this picture back here. This is the autonomic tone, taking a picture of the brain waves, and then this is the numbers that go along with it. 8 to 12 is alpha. This patient was eating disordered. A diagnosis was dysthymic disorder, generalized anxiety disorder, bulimia nervosa, and then marijuana in remission, and also PTSD. And I pulled this patient up from the archive, but low alpha was 6.1 upon admit. Normal range for an adult is 9 to 11 microvolts. So low alpha right there, 6.1. And then 3 weeks later, alpha's gone from 6.1 to 8.1. And this is doing 2 sessions of neurofeedback and using the CES 3 times a week. And then 5 weeks later, her alpha is now in range, 9.0. And again, normal range is between 9 and 11. And raising alpha is no small feat, and the numbers are pretty darn important. They don't always tell the whole story. I've seen profound clinical shifts in patients where the numbers didn't budge, but usually they correlate to one another. But basically, I just want to put forth neurofeedback as a very, very effective adjunct to the eating disorder treatment. And I think, and I tried to sum it up in this slide here, what I see is that it restores a sense of agency, that they're able to, they see that they can start to begin to regulate. And even if they're not consciously aware of what they're doing, because that's, when they first sit down, it's about inviting them to just notice what the screen is telling them, notice the feedback. It's about inviting them, just allow yourself to be in relationship with the feedback, and your brain will figure out what it needs to do. And our protocols are a little harder. They're as hard as they can comfortably tolerate, because the harder the brain has to work, the faster it learns. And we don't always have them for a long extended period of time. So, and also it supports them in this second to second experience of, okay, when I can let go and be in the here and now, and they get to really embody that, and that they also, as I said earlier, they can experience calm and relaxation, and they can tolerate it. It doesn't, it's such an unfamiliar sensation and experience, but they begin to really learn to enjoy and seek that out, and it's not, that state shift doesn't become the enemy, and that their affect tolerance goes up. And the most important thing, I think, is that it really does, neurofeedback invites them to get connected to this previously disowned part of themselves, that, okay, this head is attached to a body, and and I can be in the here and now and be connected to the present moment with all my senses. And it's, yeah, and as a sense of self emerges, and a calming and a quieting and an organizing. Anyway, I think I'm out of time. Thank you so much, and I'll take questions now.
Wonderful. Thank you so much, Ms. Stewart, for your very informative and excellent presentation. And to all of our attendees who are still with us, I would just like to bring your attention to the chat box of your control panel, where you can see a live link that you can click. That will lead you to our survey form that will need to be completed and submitted in order to be eligible to receive credit for this evening's presentation. And as a reminder, CE certificates will be issued to all qualified attendees who complete the full hour presentation and the survey. So please be sure to fill out your survey. And also, as another reminder, you can access a copy of Ms. Stewart's slides, which are in the handout section of your control panel. You can feel free to download those as well. And if you missed any portion of her presentation this evening, you will be receiving an email that will have a copy of her recording so you can review at your own convenience. So yes, we'll now be transitioning into a Q&A portion. If you have any questions that you would like to have answered, please feel free to submit those in the questions pane of your control panel. Ms. Stewart, I'll go ahead and start reading these off to you if that's okay.
Yes.
Great. First question is, could this process be effective in treatment of other disorders like alcohol abuse?
100% yes. Alcohol is actually one of the only substances, alcohol and marijuana are the only two substances that I know of that increase alpha. So that explains a lot. The brain craves alpha. So yes, the answer is yes.
Great, thank you. Next question is, how do I find a reliable neurofeedback provider?
Excellent question. BCIA.org.
Great, thank you.
Yeah, board certified is preferable.
Okay, there's another question here. I'm not sure if I'm understanding it correctly, so I'm just going to read it how it's written, but it is asking if you teach a person with an eating disorder that using the eating disorder is control in their life, would it be a good idea to give them another area to control? Aren't they just substituting when they use HRV? I hope that makes sense.
That's a good question. If they engage with the biofeedback in that controlling manner, I would orient them or invite them more towards neurofeedback then. And because if they can learn to, even though the driving force might be control, the results are going to be, they're going to bring their alpha up and they're going to feel a calmer state and more relaxed, and then that need for control is probably going to subside or dissipate, if that makes sense.
Mm-hmm.
Whatever gets them in front of the system and gets them in the chair engaging with the feedback, even if it's a need to control, we'll take that initially.
Great, thank you. Another question here is, what qualifications do I need to be able to use the CES on clients? I'm in the process of gaining BCIA certification in biofeedback. I'm at the supervision stage prior to examination.
That's so exciting. CES can be ordered online. The CES can be ordered online and no certification is needed.
Okay, great. Another question from one of our attendees is, are these devices compatible with patients that wear or use pacemakers?
Excellent question. Pacemaker, but I would say yes to neurofeedback. CES and HRV, CES is contraindicated with a pacemaker, and HRV, it's not going to harm them, but it's just going to frustrate the heck out of them because their heart rate's manipulated digitally or by a computer. So no HRV or CES for pacemakers, but yes to neurofeedback.
Another question, is this used in conjunction with or in place of psychiatric medications for depression, anxiety, etc.?
Case by case. Many of our patients are obviously being treated by our psych providers, so in conjunction with, but some are not on medication. So again, yes, they can use the systems while they're medicated. And some find that, you know, after use of you know, with neurofeedback, with all the devices in the brain center, the changes are permanent and lasting, barring someone doesn't go out and do copious amounts of LSD. I mean, these changes are permanent and lasting and cumulative, so a lot of our patients don't end up having to be on meds long term. So, but yes, the answer is yes. It can be used in conjunction with meds.
Thank you. Can these devices be used with individuals who have traumatic brain injuries?
Yes. Great questions. Really great questions.
Do you know if neurofeedback is covered by Medicaid and or Medicare?
You know what? I do not. I do not know the answer to that.
Okay.
I can find out and email you guys. I know some insurance covers neurofeedback, some does, some doesn't.
Another question, how might a dietitian use this information / training, or is it more geared for regular mental health counseling?
I think if an individual is seeing a dietitian on an outpatient basis, and let's say they have anxiety around mealtime, or that's just a hypothetical, it absolutely can be used as an adjunct to a dietitian's treatment planning. I own a CES myself, and it's the CES is a game changer. It's incredible, and I use it when I'm doing emails. I just clip myself on and use it while I'm doing emails. So it's because I mean, low alpha, as I said, is a marker with disordered eating patients, but low alpha is also epidemic in our society, just because, you know, we're a lot of us are highly stimulated all the time.
Thank you for sharing. How long is neurofeedback regulated?
Each session?
I think over the long term, if that makes sense.
How is it regulated?
Yeah. Or how long is neurofeedback regulated?
Well, if I'm understanding the question correctly, you know, some people notice change within 2 sessions. Some people notice change after 6 sessions. You know, it's case by case how many sessions someone will need. If someone's got long-term untreated PTSD, they might need 100 sessions. Other people may need 20 to 40 sessions. Does that answer the question?
I think so. Thank you so much.
Mm-hmm.
And I think you may have addressed this, but another attendee is wondering, how do you become trained and qualified to use these devices?
CES, HRV, HEG. CES is there's a lot of biofeedback courses you can take live or online. And then actually bcia.org, that talks about how to become certified to do biofeedback and to become certified to do neurofeedback. But HRV, the HRV machine, Dr. Bethel Vanderkolk, who's one of our consultants here, he was the one who said you must, if you're gonna, whatever you do in your brain center, you must have that HRV in there. So that comes highly recommended by he's the trauma expert. But those can be ordered literally online. Stens Corporation sells CES, and Amazon sells HeartMath. So those are, I don't want to say self-explanatory, but I mean people can order those for home use.
Thank you.
Sure.
A few more questions here. Where can you find these types of therapies in your local area?
I would say, again, I'm bcia.org, Board Certification International Alliance, the Neurofeedback. bcia.org will tell you if there's a board certified biofeedback person in your area or a board certified neurofeedback person in your area.
Great, thank you. How do you initially find out how your brain waves are functioning? In other words, how do you determine which technique would be effective?
Every patient upon admit, within the first 72 hours that they're here, they receive an initial assessment. So we're taking a mini map picture of their brain waves. And based on that, if they're showing over arousal, which would be not enough alpha or too much beta, then we would put them on certain devices for that, and also train a specific protocol to bring their alpha up or to bring their beta down. So it's an initial map. We're taking an arousal assessment of what their brain waves are doing at rest, just to give us a baseline.
Thank you. And is there an age range that seems best suited for this process? Or is there an age range that would require more effort than others?
Wow, these are phenomenal questions.
Mm-hmm.
My supervisor, Dr. Ed Hamlin, he says you can start someone with neurofeedback at age 4. And there's no, sky's the limit. I mean, we've had patients here at the adult facility, in their early 80s doing neurofeedback. So 4 to anywhere in between, up until, so any age. I mean, the younger the better, the less I don't want to say damage that's been done, but the less undoing you have to do the younger you get them in.
Mm-hmm. And one of our attendees is wondering, would irregular or low heart rates due to an eating disorder affect HRV?
Yes, it would show up. It would show up on the screen. They would see that, and they would slowly work to bring their coherence up by regulating their breath with their heart rate.
Mm-hmm.
I just want to jump in and say, in addition to bcia.org, ISNR, which is International Society for Neurofeedback and Research, is another great website that tells you how to find a provider in your area.
Great, thank you. Okay, we're almost out of time, but if we can maybe get to just a couple more questions here.
Sure.
Is there a specific brand or product of CES machine that you would recommend?
Oasis.
Oasis, okay.
Oasis and David Delight.
Perfect, thank you. And then, given your level of experience and mastery of neurotherapy and expertise in treating trauma and addiction, what are you most excited about for healing patients moving forward?
Wow, that question almost brought tears to my eyes. I think I want to say hitting it from all angles, but intervening at the brain level and the body, brain and body, hitting it at the brain level, intervening at the brain level and the body level. Somatic focused work. Integrative approach. What we do here at our brain centers, is I said complementary, but it's a whole integrative program. So the Tai Chi with the yoga, with the meditation, just intervening at all different levels and instilling hope that way and providing them with a sense of quieting. So their systems have a chance to reorganize.
Mm-hmm. Thank you so much for sharing that.
Mm-hmm.
Two more questions here. First, it seems developing a sort of dependency on NFB might be possible. How do you wean off patients?
I've never heard of a dependency on neurofeedback. Like people getting addicted to it?
I think, yeah, that's the question, or just like dependency on it.
I have not encountered that. I can't speak to that because I haven't encountered that. Yeah.
Thank you. And then our final question, what are the studies with neurofeedback in the individuals that are older with eating disorders over age of 40?
Okay, the two main studies that I think I sent them to you. They're in the slides on the resource page, the last page there. Those are the two studies this is the area where we need to do, and I know folks right now are working on it very hard right now, but we need more research with ED and neurofeedback, but no, the two main ones I've attached to this slide PowerPoint, and I think I sent the actual articles to you guys.
Wonderful, thank you. And we have one more last question, if we can. Sure. And how do the majority of licensed clinical psychologists view CES treatment?
How do they view it?
Yes.
I don't know. I don't know. I know actually I know there's a psychological conference convention in Arizona coming up in a few weeks in Chandler, Arizona, and that's the Psychological Association, and that we are bringing there. They've invited us to bring our brain center there to demo for 2 days. So I think they're open to it. Anything that's gonna, you know, potentially help patients get unstuck and you know, restore them to a sense of well-being. I think people are open to that, but I can't speak to psychologists in general. But yeah.
Well, thank you so much again for this phenomenal presentation. Thank you to all our attendees for your participation and for your engagement. Thank you for bringing all your great questions. We really appreciate you being here and being part of the Eating Disorder Hope community. So just as we conclude this and to wrap everything up, as a reminder, if you registered for this webinar, you will be receiving an email within the next hour or so that will include a copy of the presentation recording, so you can have access to that and review it at your convenience. And also included will be a link to the survey. And just as a reminder that if you are hoping to get a CE certificate, you will have to have completed the full hour presentation as well as the survey. And again, there will be a link included in the follow-up email in case you missed it in today's presentation. But as long as you're able to complete and submit that, CE certificates will be issued to all qualified attendees. And lastly, we would love to give you the referral number for Remuda Ranch at the Meadows, which you can contact them at 888-496-5498. And Remuda Ranch is available to help any referring professionals, loved ones, or sufferers find healing and treatment. So we hope you can access that as a resource if needed. And again, thank you so much, Ms. Stewart, for your time and just sharing your expertise on this very interesting topic. And we just really appreciate your amazing presentation. And thank you for being with us.
My pleasure. I'm grateful to be here.
Thank you. And for any additional resources, please feel free to visit eatingdisorderhope.com, where you can access several professional resources, including our upcoming webinar schedule, where you can view and register for our upcoming webinar. So we hope you'll join us in the future. So to all our attendees, and again to Ms. Stewart and the Meadows Behavioral Healthcare, we wish to thank everyone and wish you a wonderful evening. Good night, everyone.